In another direction, a delegation of nursing faculty and administrators from our college went to Haiti to research ways that nursing students from CLC can participate in volunteer efforts to improve Haitian health. They were also looking for ways to provide service learning opportunities to CLC students. Those traveling to Haiti were Dr. Larry Lundblad, president of CLC, Rebecca Best, Dean of Educational Services, and nursing instructors Connie Frisch, Darcy Gaden, and Nancy Meyer. They joined a group of local medical professionals who for several years have participated in Project Haiti as a benevolent service. The local mission has helped build a hospital in the mountain community of Pignon. The American mission is building not only structures such as a hospital and clinics, but also tons of goodwill. Haiti is the poorest country in the Western Hemisphere, but in the years since volunteers from this area have been involved in efforts to improve life around one part of Haiti, mortality rates have dropped, life expectancy has risen, and education has taken hold. CLC is working on an ongoing, long-term partnership with this hospital and nursing school in Haiti. The facility has grown to a 65-bed hospital with 4 outlying clinics that are operated by a Haitian nonprofit organization. We asked the 3 nursing instructors who went to Haiti for some insight as to their reasons for going, the conditions they witnessed, and the vision for college nursing students who sign up to participate in learning opportunities in Haiti.
Our visit to Haiti was a very life-changing event for each of us. The minute we stepped off the plane, it was evident. I mean, we could all see it and feel it. And as we progressed through our travels, it was very, very apparent that the country is just poverty-stricken, and you know, they don't have water to drink, and unemployment rate is 80% compared to what do we have, 6 to 7% here in the United States. And the patients were in wards of approximately 6 patients per ward. There were patients lined in the hallways.
And it's a little bit of a challenge because some speak French and some speak English, and this is going to be one of the challenges we work with when we are there with our students. Luckily, a lot of Haitians have some English, and that's going to be a challenge that we're looking at. We went into a classroom. It was very interesting. The students all wear uniforms, and the color of their uniforms are by the different years. And the first class stood right up and sang us a song. So that was interesting. We needed to visit every class then because all the classes needed to see us or some would be left out, they said. Another thing we got to do is visit their lab. It's very interesting because for these classes of students, and I don't know how many students there were in each class, but I would say minimum of 30 and maximum of 50 or 60 maybe, possibly more, some less. And they have both LPN and RN as well, as we do here, although we have to learn more about that. And we went into their lab, which was on a veranda, open to the air, and it had 4 beds, 2 mannequins, 1 baby, a linen cabinet that was maybe this big, and that was it. One sink, one wheelchair, and we have, you know, 4 labs here at this campus, more at our other campus, and are always working and improving on that. It's just amazing. Another meeting we had, we flew up to Pignon then, and another meeting we had was with Dr. Guy Theodore and his doctors and nurses, administrators, and student nurses there, and all of us who were visiting. And that's at the Hôpital de Bienfaisance, which means charity hospital. And we had a meeting with the nurses, the actual nurses in the hospital, which included the director of nursing, one of the nurses that was there for her service year of work, and 4 nursing recent grads. They had just been nurses for a month maybe, and also there were some nursing students around too. But one of the things that most impressed me about that meeting was the student or the nurse that was there for the year of her service nursing. We have a quote from her, and she said, "We need to improve the standard of our nursing care. Will you help us?" So it's very hopeful. We're making connections already, and we can hardly wait to go back. They asked how soon would we be back. They would be ready for us to be back in 2 weeks. We told them best case scenario might be next spring, but you know, we're working on that now, and can hardly wait to go back and think we have a good base and that we'll be well received.
After our visit, we basically have a vision and a mission established, as well as our program goals and student objectives. The main vision is really ultimately to improve healthcare standards and nursing practice in Haiti, in the country of Haiti. A large piece of this, in addition to the actual standards of care that we will provide clients and families with, is really to improve the standards of nursing education in Haiti as well, and to work in collaboration with a Haitian college yet to be determined on that part of the project. For us, in looking at what international education in Haiti could do for our students, the biggest piece is that we have a very limited, diverse population here in central Minnesota. And so it becomes very difficult for us to create these learning opportunities for them. Certainly we do some of this in our nursing simulation lab, but we can't create real live patients within our communities and within our hospitals for them. So this type of experience would be unlike any other that we could duplicate or replicate them for them, in the classroom. Our model will look something like one nursing student from Central Lakes College paired with another nursing student from a college in Haiti, and that pair will take care of a group of clients. This, we're hoping, will produce unique learning opportunities with Haitian nursing students and American nursing students working together, but as well as help with the communication piece and the communication barriers that we know that we will be looking at in the village of Pignon. So we have a list of different topics, learning objectives that we know that our students will be able to achieve and meet and be exposed to, but we do still need to develop those. So we are very excited about the learning opportunities and the potential for our nursing students.
CLC faculty will accompany the students and provide instruction and clinical supervision. The director of the Pignon Hospital is hopeful that the nursing standards at that hospital and beyond will be improved as a result of the partnership.